for 20 years prior to coming into this role. I've been in this role almost 6 years now. Next month will be 6 years. And definitely an understanding of flexibility. You have to be flexible and willing to think outside the box sometimes. You know, within healthcare we have certain regimens and there's certain rules, but there's also a bit of thinking outside the box and what can I do differently. You have to really have patience. If you didn't have patience at the bedside, which we all need to have as a bedside, you have to even have more patience when you're dealing with multitudes of people who all have different needs and who are looking and pulling to you for answers. Knowing that it's okay to say, I don't know, because sometimes you just don't know. And finding the answer somewhere else and looking for that answer somewhere else. Knowing that you have to come with a skill set, but nobody's looking for perfection. It's an area where you can actually grow and learn different things about yourself and even grow within your strengths, grow your strengths and improve on your weaknesses. I think qualifications-wise, yeah, that's probably good for qualifications.
Would you say you've grown a lot in the 6 years?
Oh, yeah.
I've seen tremendous growth in you.
Yeah, for sure.
Tremendous growth.
For sure.
You've blossomed into a rock star leader here.
She's being kind. There's lots to learn. There's still lots to learn every single day. I think that I really enjoy what I do. I really enjoy what I do. Every moment of every day is always, I think, there's always challenges that occur. And after a while, I mean, you get so comfortable with certain parts of it because some things don't change. Patients come in, patients go out, people have conflict, that's all the same. But it's how you handle it in the moment, actually, that makes the difference. So it's learning how to handle that in the moment and making mistakes and saying, you know what, I made a mistake, move on, correct it, move on, apologize who you need to apologize to, and you move forward, going forward with that. But it really is a very interesting outlook. And I would tell you, being a bedside nurse for 20 years, I never really looked beyond my patient really much. I always focused on the patient and what I had to do for my patient. You were conscious of the fact that, yes, there were financial restraints, and you had to be conscious of how you were using equipment and pieces and, you know, want things to break and use them properly. But being on the other side, where it's so much a larger view, a scope of what happens from an individual needing a service and being able to get the service that you have, and then saying, okay, you no longer need our service, where do we go to next? And how do I facilitate you to get to the best place possible so you actually have the best outcome that you can have? And it's the whole journey of that patient's journey from the moment they hit our doorsteps to the moment they leave. So I guess Attawapiskat, that would be my next thing, going to Attawapiskat, and I did that in 2009 for a month. There was a program within our organization that allowed us to go outpost nursing. So you had to go for a minimum of a month, which was good. I went 2009 in the summer for 6 weeks, and I went again in 2010 in February for a whole month. So I did a summer and I did a winter, and I absolutely loved it. I absolutely loved it. It was different than anything I've ever done. I've done a lot of medical missions trips, so it intrigued me that I've done mission trips where you go to third world countries and you help out. So in that sense, I've done that, and I was kind of thinking it would be kind of like that experience. It wasn't. It was completely different than that experience. So being an ICU nurse, it was primary nursing care, what it was. It wasn't acute nursing care. At the end of the day, I still have a skill set of acute nursing, but it was a completely different way of assessing and seeing your patients, because for the most part, they're healthy people. And they're coming in because they have aches and they have pains, things you would see a doctor for. Now, in Attawapiskat, where I was, it was a reserve, and it was 1,500 Cree Indians, and it was an island. It was surrounded by water. And the only way in and out was by plane, and the plane came at 1:30 every day, weather permitting. Bad weather, no plane. Good weather, you had a plane. Which was kind of tough when you had sick patients, because it means you couldn't get them out to another hospital or the other bordering cities that actually had more help. So I struggled with that a lot, because you had sick people and they needed to leave, and you're thinking, I'm in Canada and someone doesn't have access to health care, and I'm in Canada, how is this possible? And it was an unbelievable eye-opener to the poverty that exists within my own backyard. I have been to many third world countries, and I was astounded. I honestly felt like I was in a fourth world country. I couldn't believe I was in Canada. honestly could not believe I was truly living in my own country, where there was access, where I came, a 4-hour flight, access to whatever you needed, and now I'm in the middle of what seemed like nowhere, and you can't even get, it's so hard to get a physician. So physicians came once a week, every month. There would be a physician. They'd come in on a Monday, on the 1:30 plane on a Monday, and they would leave on the Friday 1:30 plane to go out. And there was always a huge lineup to see the doctor. In the meantime, as nurses, you functioned as a nurse practitioner in an extended role. We had one nurse practitioner actually who worked there and oversaw us, but nobody had the designation of nurse practitioner, but you literally functioned as a nurse practitioner. You saw your patients, you diagnosed them, you decided on the prescription that you were given, what it was needed, whether it was antibiotic, pain medication. You went to the pharmacy area, you literally counted out your medications, you labeled your pill bottles or your eye bottles, you punched in your tables, you labeled your bottles, you filled your pill bottle, you put your cap on, you put the instructions in, and you would send them off with their medications. They had a compendium, a book, really had every single disease process that you could think of that was in that book, and how to treat based on symptoms and what you saw. And you had each other as well to bounce ideas off. And the nurse practitioner was there, and the director actually of the hospital was a nurse himself. So and they were really excellent at helping you troubleshoot. But you really learned on the spot. The nurses put casts on themselves. They would cast patients' arms. They sutured. They didn't deliver babies up there because they were really too far away from help if something went wrong. They did have an incubator in case, babies, they're coming. So in case a person did actually deliver, they would actually have resources available. But anybody who was pregnant would leave at 23 weeks, and they would go to Timmins. They would send them to Timmins, and that's where they would have their babies, and they would come back. And it was precautionary because they really didn't have a resource in case something went wrong. It was, as a nurse, you really learned from, as I guess it would be, from cradle to grave. You had the whole gamut of the lifespan, from newborn babies coming in for healthy checks, which honestly, I'm not a pediatric nurse. I worked in acute care in an adult setting, and that frightened me completely, having to take care of a child or what to do for a baby. But after a couple weeks, and everybody there was really great on helping you walk through what you did, you got more comfortable. You got a little bit more comfortable, the assessment, what you looked for, what you didn't look for, encouraging the parents and what they needed to do. It was nutrition. You're the dietitian, you're the pharmacist, you're the physician, you're the physiotherapist. You're the whole gamut, because you do everything, because there isn't really anybody there. The dentist, they didn't have a dentist as well. A dentist would come once a month, if they had one, for a week. And that was really sad. I found that really sad, because I remember when the dentist did come for a whole week, and there was a lineup for the entire week, and not everybody actually got seen. I remember a little girl coming down with her mom after the dentist had left. She had an abscess, her face was swollen, and her mother couldn't get her in to see the dentist. And she ended up having to go to Moose Factory, which was another hour away, and eventually getting her daughter to be seen, because she really had needed seeing care for her mouth. It was really badly infected. And I'm just thinking, how is this possible in Canada? We're in Canada, and somebody can't have access to a dentist. It blows my mind. But this is where we are. This is what part of Northern nursing is all about. It was a lovely place. There really wasn't a whole lot to do. There was one grocery store called the Northern, which I understood that most reserves have, called the Northern Grocery Store. You got your groceries, you got your furniture, you got your clothing, everything was at this store, one stop. There was 3 tuck shops, and one had like ice cream and things, and the one had candies and stuff, kind of cool places you could go to get things to eat, sweets. And it was a very small place. You could walk the whole place in half an hour, probably. Walk the whole place in half an hour. But as far as, I met a lot of nurses. A lot of nurses go up there for locums. Financial wise, you can make really good money if you're thinking about making money and learning a skill set that, and you come to the south, as they call us down here, because we're up at the north, and they call it working in the south, where you have everybody you have a respiratory therapist who handles the lungs, you have a physiotherapist for your mobility, and you have the occupational therapist for environmental things and hanging on to forks and railings. And it was really an eye-opening experience to figure out, how do I do something when I don't have those things available? How do you take